afternoon for what is going to be a really great presentation. We're so excited to have Erica with us, who's with Health Partners on Intimate Partner Violence and Exploitation Futures Without Violence. She has 35 years of clinical experience working with youth and families and has been providing training and technical assistance in the area of sexual and maternal health for adults and youth with disabilities, adult and adolescent relationship abuse, minor consent, and confidentiality. And we're really pleased to have this session on intimate partner violence, human trafficking, and youth. Pleased to have a really great presence here today of community health centers, school-based sites, and the providers within those organizations, as well as collaborators from the school district. So we'll have a very brief survey at the end that we'll hope you'll complete for us. And we so appreciate Erica's expertise. And with that, I'll turn it over to you.
Good morning, everyone, and thank you for the opportunity to talk about this, excuse me, very important issue today. So I just want to start, next slide, please. Sorry, thank you. So this is just some background information on Futures Without Violence and the Health Partners on IPV and exploitation. Futures has a myriad of resources. You will have received, I think, a digital page with all of the links, but also the links are here in the presentation. Lots of resources for health centers, lots of resources for folks working with young people, as well as many other populations. Our objectives today are to identify the dynamics and impacts of adolescent relationship abuse and human trafficking on youth, to look at best practices for connecting survivors with services, and to we'll talk about key partnerships to provide ongoing care and resources, and to identify several strategies to promote healthy relationships and reduce the risk of abuse and exploitation, both in the clinical encounter as well as for school-based clinics in the school as well, in the institution. So I just want to start by saying domestic violence and intimate partner violence are very common. And so whenever I do a presentation just based on the data, I know that there are survivors among us. So do take care of yourself. If this is in any way triggering for you or makes you feel uncomfortable, step away. Respect, if you want to share a story or ask a question, make sure that you're not divulging so much information that we might guess who you're talking about. And don't be shy. If you have a question or a comment, please do raise your hand and we will talk with you. Okay, next slide, please. And I've been forgetting to say next slide because I'm advancing them here. So those were the learning objectives, the important notes, and let's move to the next slide. Just a word about language, IPV, intimate partner violence, TDV, teen dating violence, ARA, adolescent relationship abuse, all are refer to similar dynamics in relationships. In general, IPV is used to describe adult relationships, and either teen dating violence or adolescent relationship abuse can be used interchangeably. But relationship abuse really encompasses the range of behaviors that are associated with unhealthy relationships in adolescence, whereas teen dating violence really sort of more focuses on the physical aspects. Because this is such a much broader set of issues, I prefer to use adolescent relationship abuse. Next slide. So let's talk a little bit about the incidence and prevalence. Why are we even concerned about this issue? Next slide. So and you can hit that again, in unhealthy relationships, we see one person using a pattern of methods and tactics to gain and maintain power and control. So power and control are really the keys here. There are lots of reasons that these dynamics that develop, but it is essentially an issue of power and control. Click again. Jealousy, social status, mental health issues, money, tech, substances, many tactics are used to be controlling and abusive. And tap again. Sleep disruption, substance use, coercion, and physical abuse are not uncommon strategies. These are the ones we think of very frequently when we think about power and control over another person. But all of these methods are ways of exploiting and controlling others. Let's go to the next slide. This, unfortunately, is a very common set of issues. You can see the data here. This is all pre-pandemic data from the Youth Risk Behavior Survey. So this was from 2020, so gathered prior to that. So you can see here how very common it is to see both in young men and young women that they are experiencing physical dating violence. Um, you can see in the center box about 1 in 9 and 1 in 36 male high school students reported that they experienced sexual dating violence. And then that far right box, 26% of women and 15% of men experienced intimate partner violence for the first time before the age of 18. So this is a behavior and a context of relationships that is very common in young people. And those young people who are involved in abusive relationships tend to get involved in abusive relationships as adults as well. Next slide. We're also talking about human trafficking. And human trafficking is a large and growing problem worldwide and in the US. We often think of trafficking in terms of labor trafficking for moving people, recruiting, harboring, moving, or obtaining a person for labor or services. That is the legal definition. And that you don't actually have to move a person across any border, state, municipality, or international border to engage in labor trafficking. And what's most important for us to think about is, in terms of youth serving, is sex trafficking, because anyone who's induced to perform sex acts through force, fraud, or coercion, any commercial sex act, or anyone under the age of 18 is considered being trafficked. And again, this is an issue that we see among young people, an important issue to keep in mind. Next slide. There's a continuum of sexual violence, exploitation, and trafficking. You can see the definitions here, but sex trafficking is a subset of sexual violence and sexual exploitation. And again, is very problematic for young people, especially those who are homeless, runaway, or involved in the foster youth care system. Next slide. We talk about these things together, intimate partner violence and human trafficking, because there is our shared dynamics. You have physical and sexual violence that takes place. Click again, restrictions on freedom of movement, control. Click again, isolation. Click again, financial control. And again, intimidation and fear, or finally, coerced drug and alcohol use. And most importantly, if you click one last time, the person exploiting a young person is often a romantic partner, a family member, a caregiver, or someone in their social network. Recruitment off the street is less common, especially for housed youth. However, we do see many cases of recruitment off the street for young people who are living in group homes or foster care situations, as well as homeless and runaway youth. Next slide. Some additional data, just because we often think of this as young people in heterosexual relationships and male on female battering or abuse. We do know that youth involved in same-sex dating are just as likely to experience dating violence as young people in opposite-sex dating. This is old data. It has not been looked at again among young people, but among adults, we see a similar pattern. And something that's a little more unique about young people, perpetrators are equally likely to be female or male. Girls are more likely to be victims of physical abuse. Boys are more likely to be victims of psychological abuse. But mutual aggression is pretty common. However, just because of how young women and young men are taught to fight, how they're taught to hit, etc., as well as the size and force differential, young women are much more likely to experience physical injury than men are. Next slide. What makes young people so vulnerable to these issues? Well, certainly growing up in a household or an environment where they've been exposed to abuse, either their own abuse, child abuse, and or witnessing domestic violence in the home makes them more vulnerable. Being young, 16 to 14-year-olds have the highest rates of abusive relationships, and then substance involvement, which can be seriously manipulated and used to maintain power and control, is a very significant risk for abusive relationships. Next slide. The health impacts are myriad. Now, this is adult data, and this is from the Centers for Disease Control. And these are all of the different acute and chronic health problems that have been found associated or at higher rates in the context of intimate partner violence. And you can see it's, although certainly black eyes and broken bones are very significant and important, there are so many other issues that are more subtle and impacted by this problem. Next slide. In youth, the impacts are similar. Young women who've experienced abuse have higher rates of mental health problems such as depression and anxiety. We see higher rates of eating disorders, both bulimia and anorexia nervosa, in young people who are in abusive relationships. There are higher rates of suicidality and higher rates of substance use. And girls, in this study, it was girls in grades 9 through 12 who initiated sex at an earlier age are also at higher risk for physical sex, dating violence. Next slide. When we talk about coercion and substance abuse coercion, this is also a very significant issue in trafficking. Traffickers may introduce their victims to substances, but also often will target young people who are already substance involved to force them into an exploitative situation or circumstance. And over a third or around a third of individual traffickers will manipulate or coerce through substance use. And when you look at gang organized trafficking, and this is more commonly recruiting off the streets unless the parent or caregiver is gang involved, you can see that over half will use substances to control their victims. Next slide. So as I mentioned, traffickers may introduce substance. They may use substances to maintain their power or control. And there's also the stigma of substance abuse. And that's what will prevent law enforcement, healthcare providers, and other potential helpers from seeing signs of human trafficking. So you see the young person, there's substance involved, you focus on their substance use, and you don't go further to figure out or understand how this was initiated, how it accelerated, what is the context in which they're using, what is the context in which they're obtaining their substances. And so it makes them extremely vulnerable. Sorry about forgetting to advance slides. We also see a dynamic. Now, this is a dynamic that's been studied in young people, but probably is equally common now among adults as well, but we don't have the data. But back in 2013, 1 in 4 teens in a relationship reported that they were being controlled, called names, harassed, put down by their partner via texting. That was sort of pre the huge increase in social media use among youth. Next slide. Why we're concerned about this is because cyber relationship abuse doesn't happen in isolation. It's a red flag for other abuse. So you can see the data here. A majority of young people who experience cyber abuse also say their partners psychologically abuse them. Over half say they were also physically abused, and a third say that they were also sexually coerced, again, in this data from 2013. Um, as far as we know, this has only accelerated and become more of an issue with the extensive use of social media. And I think a lot of the data that we know around the mental health impacts of social media involvement reinforce this idea that probably relationship abuse is further accelerated and facilitated through cyber abuse. Next slide. Um, I mentioned before we see this cascade of effects for young people who initiate sex before the age of 15. And youth who experience sexual dating violence are much more likely to have initiated sex early, have multiple partners, use alcohol or drugs in the context of their sexual encounters, have a history or current sexually transmitted infection, inconsistently or don't use condoms, and may have a partner with known HIV risk factors. So that whole cascade of impacts with early sexual debut are also associated with intimate partner violence or adolescent relationship abuse. Next slide. When we look at pregnancy, we see increased risk for unintended pregnancy among those in abusive relationships, and an increased likelihood to become pregnant when they don't intend to be. Next slide. During pregnancy, adolescents, adults as well are more likely to experience violence, but adolescents are even more likely, 2 to 3 times more likely to experience violence during their pregnancy. And then with rapid repeat pregnancies, we see adolescent mothers who were abused within 3 months of delivery are almost twice as likely to have a repeat pregnancy within 2 years. Again, this data is old. Pregnancy rates among adolescents, unintended pregnancy rates are lower than they were, but the dynamics remain really problematic. Next slide. I know many of you are school-based health center providers, and so what happens at schools is also very important. Both victims and perpetrators in violent relationships are more likely to carry weapons, as well as engage in physical fighting and other high-risk behaviors. Um, and those who have been victimized have an increased risk of school dropout, lower grades, and just being generally less connected at school. And we know how important connectedness is in terms of school success and engagement. Next slide, please. And then we think of the very worst outcome, and this data has remained consistent over time. A third of female homicides among adolescents, so those are between the ages 11 and 18, are committed by an intimate partner. So this is not only very emotionally damaging, physically damaging, potentially damaging in terms of reproductive health, but is actually life-threatening. So, excuse me, you're one slide ahead of me. We rarely identify adolescent relationship abuse or human trafficking in clinics that serve adolescents, even though it is a very common problem. From a study that I was very involved in, looking in school-based health centers where I did the training and technical assistance for the health centers, we found much higher rates of reported adolescent relationship abuse for those young people who use school-based health centers, as well as a very large study looking at reproductive health clinics. So the rates we were looking at in the general population, you can see are amplified among those in clinic-based samples where they were given the opportunity to talk about relationships. And for human trafficking and exploitation, we don't really have the data. It's very difficult to obtain. but we do believe that those seeking help in adolescent specific environments or adolescent serving environments may also be at higher rates of experiencing human trafficking. Next slide. So in summary, next slide, please. It's important to remember that relationship abuse is very common. It is associated with multiple risk behaviors and poor health indicators. It has very significant consequences for the health and well-being of youth. And when we look at that subset of young people seeking services in clinics, it's even more common than in the general population. Next slide. So, knowing this, why do we avoid exploring the topic? Well, we may not prioritize it because we're not aware of the prevalence and impact. So, hopefully, I'm talking to a group of people who now are more aware of the prevalence and impact. And then there are our own personal barriers. A lot of times we don't go there if we don't know how to respond. So we're unsure of what to say if there's a disclosure, so we don't ask. And we're unsure of what to do if there's a disclosure because we figure, well, if we can't do anything about it, why, open Pandora's box? And so I'm hoping to give you some information and tools so that you feel more able yourselves as providers to really look at this issue with young people and offer them support. Next slide. So we're going to look at the opportunities for screening and intervention. Next slide, please. And I'm going to be sharing with you an intervention that was developed by Futures Without Violence, which is the use of a safety card. Sorry, I'm just looking in my desk drawer here because I always have safety cards, but I'm not digging one up. Here's one. So this isn't the safety card we're talking about, but they all have essentially the same makeup. They are small. They provide an opportunity to talk about healthy relationships. They have primary prevention messages by identifying signs of unhealthy relationships. They educate about what to do if there's a friend or family member who may be struggling with abuse. They plant the seeds for adolescents who are experiencing abuse, but not yet ready to disclose that you can talk about this and there is help. And then they give people the tools to learn about safety planning, harm reduction strategies, and support services. And all the cards, although again, this isn't the card we're talking about, they're like this. They're small, they unfold, they have multiple panels. Something they all have in common is they start with talking about healthy relationships. And on the back panel is always, and we're going to look at these, a panel that talks about, that has resources. So even if there is not any information shared with you, there's still the opportunity for the young person to seek help. Next slide. So this is part of an intervention called Cues, and you can see at the bottom of this slide, there's a link for an infographic that you can order. All the things from the Futures store are free. You pay a shipping charge, a one-time shipping charge. So, you want to know everything you want to order and order it all at once. So it's one box. But there are infographics, so charts that you can put up for providers so that they remember what to do. There's online trainings and many, many resources and cards. The steps are, it's a mnemonic. So the C is for confidentiality, and you want to make sure that you have disclosed the limits of confidentiality, particularly because with a young person, we are there are issues that might emerge where child abuse reporting is indicated, and you don't want to promise confidentiality and then have to breach it because of the exception for child abuse reporting. Now, in your state, child abuse reporting is for parents, caregivers, people who have custodial responsibility, and those who are engaged in care. So it's not a partner unless that partner is an older partner. So when it's a peer partner, this is not reportable, but you may have situations where it's reportable because it's an older partner or it's a trafficking situation. You want to make sure you're always seeing the young person alone. They are not going to feel comfortable, nor is it appropriate to talk about these issues in front of another person. So you want to always make sure you're alone with the patient. You want to normalize the activity, not normalize abuse, but this is universal education. And because this issue is so common, We talk to everybody about relationships and how they affect our health. And you can see there's a little script there just to give you an idea of how you might introduce the card. So that's the UE, Universal Education. And then the S is for support. And you want to make sure you know where are your youth-friendly resources in order to make a warm referral. So that's not just a piece of paper or a card, but really a facilitated referral where you have those relationships and can make sure that they're getting to a place that they can get help. We'll talk a little bit about that later. And make sure that you follow up the next time you see them. How are things going now? Were you able to access that help? Make sure that you don't just, kind of check it off and now we're done. Next slide. These are some guidelines. You want to make sure the patient is alone without parents, partners, or friends. We want to talk to everybody, regardless of their gender, sexual orientation, or even relationship status. They don't have to be in a relationship. They don't have to have ever had a relationship to talk about healthy relationships. Next slide. You want to do this at least annually and with each new partner. And you want to provide universal education during any health appointment, including ones that don't seem to have anything to do with relationships like sports physicals. Young men we encounter much less frequently in healthcare in general and may only see in the context of a required physical in order to participate in sports. So you want to make sure that you're, getting to young people and being able to talk to them. And so it's really important that you go ahead and take every opportunity to talk with them about these issues. Next slide. So these are just, oops, and the one after that. Thanks. So these are just a couple of slides. You have a link there in your sheet where you can look at these safety cards, decide if you want to order them. But I wanted to give you an idea of what's on them. So there's a range of issues. As I mentioned, they always start with information about healthy relationships. This was developed with Youth Advisory Board and the Society for Adolescent Health and Medicine. So the language is appropriate for young people, it's accessible, and we try to use terminology that's familiar to them. So healthy relationships, next slide, some information about respect and what you want to experience in a relationship. Next slide. Signs of an unhealthy relationship, and you can see it goes from checks to X's. So the messages are very clear that these are not things that are healthy or desired in a relationship. They're not appropriate. They're not safe. And that if you're experiencing these things, you are not alone, that you don't deserve it, and that you can get help. So these are those essential messages for someone who is experiencing an unhealthy relationship. Next slide. We also address issues like cyber abuse, adolescent-specific relationship abuse patterns. And you can see it kind of says, how you might feel like this is a great thing. This person really likes me. They're texting me all the time. But you also want the youth to be aware that when it feels controlling, when you're afraid to not answer, when they jump all over you and say, why didn't why did it take you 5 minutes to respond? That this is a way of exerting power or control. Look for these signs even in the exam room. I've had young people with their feet up on the table who all of a sudden are their phone's going off and they're picking it up. And I'll always ask them, what's going on there? Seems like that's a really important call. And maybe it's, mom saying I need to be home to take care of my little brother or sister, or maybe it's nothing problematic and it's a friend offering support, or maybe it's a partner who's saying, where are you? Why aren't you back? What are you doing? I want to know. So this can be an opportunity to really look at relationship quality. Next slide. There are some messages about sexual self-determination, that you have the right to make these decisions for yourself and nobody should be deciding for you. Next slide. Specific messages about the risk for human trafficking. So these are messages about sexual exploitation, and you can see that the phone numbers there at the bottom of this one are actually to connect with services for people being trafficked. Next slide. We also want to see young people change their approaches and change bystander behavior. And we know that altruism and helping their friends, peer relationships are so important in young people's lives. And so these are some messages around helping your friends or when you observe something, on the yard, before school, in class, etc., to really, to share the card and to be aware that when someone is talking about suicide or feeling so sad that they're thinking of hurting or killing themselves, friends can help. And calling the suicide hotline to get help for how you can get help for your friend, or you're helping your friend to call themselves, are ways that we can reduce their risk and help them to have a better outcome. Next slide. And then, as I mentioned, every of all of the safety cards have national resources on the back, and these resources, again, are targeted to the population, in this case, adolescents. So that's a quick preview of the card. I really encourage you to look at those, the Q's video, how to do the intervention. And to use these cards. They're very useful conversation starters. We've done research to show that just having them like sitting on the brochure rack does not do the trick. They really you need to engage, you need to offer it, you need to open it and show them what's there. It can be a very quick interaction, or it can be the door opening to a deeper conversation. Next slide. Remember that we are not addressing these issues because we're trying to get someone to tell us. We're addressing these issues in order to enhance safety. So even if they're not ready to talk about it, even if they're not ready to leave a relationship, recognizing and validating their situation is really important. Excuse me, and makes a difference. You can really reduce their sense of isolation and shame, help them to think about change, and encourage them to believe that maybe a better future is possible. Remember that young people have, a 15-year-old has very limited life experience, and what's happening in this relationship may be the biggest thing happening in their life, the only thing that they can see, um, and the most important thing that's influencing their decisions. So things can look great in other aspects of their life, but if they're experiencing relationship abuse, they may really be experiencing a lot of depression, mental health problems, and desperation. Next slide. So disclosure is not the goal, and disclosures do happen. So you want to be prepared in terms of how to respond. Next slide. These are some things that you can say. So, even when you don't know what to say, some important messages are first endorsing that you believe them, that this is happening, that you appreciate them sharing their story, that you're sorry that this is happening to them, that they don't deserve it, because abusers will often blame the victim, saying it's your behavior, it's that you were looking at that other person, you were talking to them, you didn't meet me at the right time, it's your fault. So you don't deserve this. And it's not your fault. And most importantly, you're not alone, that there is help available. And then you want to make a warm referral. In order to make a warm referral, you need to have relationships. And the next part of this talk is going to be about those relationships in terms of partnering with other agencies who can help you do this work. So you want to make that warm referral. If it's possible to make a phone call from your office, remember that sometimes, especially for young people being trafficked, excuse me, if they have a cell phone, it may be controlled by someone else. And young people's phones, often their parents will be the person who has the contract. You can get a list, you do get a list of every phone call made. So sometimes it's not safe to call for support from a cell phone. So offering your phone in your office, a space to meet. Some programs even will co-locate a domestic violence advocate or counselor at their clinic or school-based health center for one or a couple of days a week. Kind of depends on your situation, but there's lots of creative ways to make those connections, but it's not a phone number on a card. On the other hand, there are the national hotlines and text lines. And for young people who don't want to engage right now or in the clinic or with you, those are resources you want to point out to them. And then you want to talk about some ways that they can maybe make themselves safer and really protect their health. Next slide. There are situations where you may have to make a child abuse report. Again, this may be in situations where there's an older partner. Um, and I'm sorry, I'm not familiar. It's just the California law is so stuck in my head. I can't remember in Kentucky what the criteria would be for abuse reporting. I believe it may be a partner over 21 or over with the younger partner is 16 or younger. But I would advise you to check if you don't know. But these are potential child abuse reports. You do not want, after you've built this relationship, to blow it up with child abuse reporting. So first and foremost, make sure you talk about that at the front end. When you talk about confidentiality, you have to talk about situations where you might have to share information to keep them safe or help them get help. And if you do need to make that report, you want to remind them, you mentioned this earlier, you are required to make the report and then explain to them what's going to happen. Don't make promises because you don't know what happens with your reports, what's going to be picked up, what's going to be unfounded, what's not even going to be addressed. But you can make a situation where it's safer for the youth in terms of seeing if they can call or meet with an advocate to develop a safety plan in case of retaliation. And make sure you're maximizing the client's control and role in the process. So it's not a secret paper that you go to a secret room and fill out. You can do this with the young person, have it be as transparent as possible. Next slide. There are internet resources and online or text chats that young people are often more interested in utilizing than phone. So loveisrespect.org is a great resource. They have a website, they have online texting, they have, you can text love is to that phone number. And there's a phone number you can call and talk. Again, making your phone available may be helpful to the young person. This information is also on the back of the safety card. Sorry, I forgot to advance the slide. Would you please? So this is the resources for loveisrespect.org. And again, you'll have these slides as well as this is on the back of the safety card and on the digital resources slide sheet. Next slide, please. So just a recap about the safety card intervention. This is universal. We don't pick who we talk about it. We talk to everybody. So normalize the activity. I give this card to all my patients because relationships are so important in our lives and relationships are so important to our health. Make sure that you don't just hand the card, that you open it up, do a quick review. It talks about healthy and safe relationships, how relationships affect your health. Make the connection, create a sense of self-determination and altruism. We give this to everybody so you can help yourself, know how to get help for yourself, and be able to help a friend or family member. And then again, of course, emphasize what resources are on the back. Next slide, please. I want to remind you, because we've been talking about all this risk, that there are many protective factors among adolescents, and those of you who are involved in community, school, or clinic-based services are a big part of this picture. We can facilitate access to services, talk about these issues, and provide support in school, provide mentorship for young people, and make sure that neighborhoods have resources for young people. So much of the work that we do around advocacy for young people also protects around in the issue of relationship abuse. Next slide. So I've mentioned over and over again partnerships. Partnerships really are the heart of this intervention. We cannot do this work alone. We are not experts in this area. And yet in our community, there are experts, and that's who we want to access. Next slide. Some of the benefits of partnerships, certainly even among us providing services, um, we have we may be as staff members experiencing domestic violence or intimate partner violence, and these partnerships can benefit us as well as our patients. We can there's health enrollment for clients and staff. There's the opportunity to establish a primary care provider, address emergent reproductive health issues, and facilitate continuity and care of chronic conditions. The state and tribal coalition links are at the bottom here, so that you can find your state and tribal coalitions. Not every state, not every tribe participates in a coalition, but they're not in every state or territory. So much of this work may be internet or phone based. Next slide. In terms of state coalitions, Zero V is your Kentucky State DV coalition. You can see here, there's the phone number. I'm sorry, the slides look a little cut up here. My apologies for the one that you're viewing. The one I'm seeing looks better. But there is the phone number there for Zero V, as well as their website, as well as the National DV hotline, which they will route young people to adolescent appropriate services if the young people call the domestic violence hotline. But if you look at Zero V's website, they have material on teen dating violence. They have services for young people, and you can see on the map there where they have shelter or services. So what you want to do is, this map is on their website, and you can look at what area or what county you're in, what region you're in, find out which organization is serving them, your area, and then contact that organization directly to find out what kind of services they have for adolescents. Next slide. The reason that we want to really partner is because domestic and sexual violence organizations and programs are the experts. They know how to do safety planning, which really is an art. And they have lots of services. It's not just shelter. And sometimes shelter is actually not available to people under 18 because of regulations around housing. Shelter may not be the most salient issue for young people who are experiencing dating violence as well, but there's lots of other services: crisis safety planning, housing, legal advocacy, support groups and counseling, including for young people, including that they'll come out to your school site, etc., and do support groups and counseling, children's services, and employment support. So lots of different things that DV agencies and programs do. Next slide. And they really are the experts. You don't have all the resources, you don't know all the resources, it's not your area, and there's lots of other things you need to do in the context of healthcare. So they can help you problem solve. They can help your clients and have vast experience with this. And they can help them to increase their personal safety while they're kind of assessing the risks. So they are the experts. We want to partner with them. Next slide. Futures Without Violence has to develop some sample MOUs that are editable. All of these things, plus steps for establishing a formal working relationship, thinking about these bi-directional warm referrals so that DV agencies can refer to your health services and your health services can refer to the DV agency. And really looking at more holistic and coordinated care is facilitated by establishing an MOU. And all of these resources are, again, available on the Futures website. And I really encourage you to take a look at them. Next slide. There's also the issue of legal aid for those young people, particularly who may be being trafficked. and or need access. We'll talk in a second about the Takedown Act, need access to the some legal support for the Takedown Act. But lawyers can be helpful. Lawyers are sometimes necessary. And many people do not have access to lawyers. And so looking at developing a relationship with legal aid for a myriad of reasons and problems that may present in a school-based health center is also an important step. And that's a link there that here with a line under it is a link to legal aid programs. Next slide. An important new law, the Takedown Act, was implemented in 2025. It does require social media companies, corporations, facilitators, providers to respond within 48 hours when there is a non-consensual online publication of visuals, intimate depictions, either whether they're AI or actual. So this is something that, again, you would need legal support to initiate, but it is possible to get those images offline. And again, these images, we have many, many cases where young people have actually committed suicide because of these experiences. So the Takedown Act is an important resource for young people as well. Next slide. For those of you in school-based organizations or clinics, partnering with youth is a really important part of really changing school culture and youth culture around relationship and healthy relationships. So partnering with health classes, many clinics and schools will already do presentations in health classes. You can do presentations on healthy relationships or encourage the teachers that you're working with to use your relationships with your local DV, domestic violence advocacy organization, to come in and talk about healthy relationships. You can partner with existing clubs to promote healthy relationships, incorporate this content into small group educational sessions. Develop, if you don't have one already, a youth advisory council and get them on board so that when teen dating violence month comes around in October, you have a robust response, tabling information, etc. Work with existing advisory councils to incorporate healthy relationship promotion, and have programs right at your clinic, like office hours, where teens who are interested in talking about relationships and relationship quality or promoting healthy relationships can gather. Next slide. So again, you want to teach healthy relationship skills. Oops, we skipped one. There we go. Engage adults and peers who have influence. Disrupt the developmental pathways towards partner violence. So identifying those young people at risk and giving them particular attention and support. Create protective environments where there's a zero tolerance for harassment, bullying, stalking, and abusive language in your school or in your clinic. Strengthen the supports for families. Remember, we are talking about young people. And often if parents were aware, parents would be supportive if parents are not involved in the perpetration of the problem. And supporting survivors to increase their safety and reduce the harm that they experience. Next slide. So again, I want to reiterate, I don't want you to feel overwhelmed. You do not have to be an expert in domestic or sexual violence to recognize and help young people who are experiencing unhealthy relationships. And we know because of research that we've done that really contacting adolescents during clinic visits is a unique opportunity. We can do healthy relationship education and primary prevention. We can do early intervention if a young person is in a relationship that's unhealthy. We can do secondary prevention when they are already engaged or have had a series of unhealthy relationships or have been trafficked. And again, I just can't emphasize enough how important in terms of you thinking about your next steps is partnering with your DV or sexual assault advocates that are in your area. Again, when you look at that map, Kentucky seems like they have pretty robust resources, and they can really provide the full range of services that are necessary. Next slide. There are some key resources that Futures offers. If you can go to the next slide, hopefully it will project well. We just finished and published a Youth with Disabilities and Human Trafficking educational brief because youth with disabilities are particularly vulnerable to trafficking. Um, and you can see there's all sorts of resources. There are clinical guidelines. They are a bit old now. They were published a while ago, but the essentials remain the same. The safety card. There are posters you can put in your bathrooms, in your clinic, in your waiting area. Resources for young people. That one with the pretty flowers on the front is about for young people who have experienced adverse childhood experiences or ACEs. Um, so there's lots of resources, and I really encourage you to take a look at the Futures website so that you can see what's available to you. Next slide, please. These again are the national resources with the phone numbers and links to the helplines and resources that young people can access. And Love is Respect, the teen health line, is probably the most appropriate first stop for most young people. But the national hotline will also redirect them to those resources without them having to make another connection or another phone call. You can see the trafficking resources are a little different. If you're not sure what's going on and you start with domestic violence and sexual assault advocates, they can further explore this and figure out whether it's a trafficking situation. You can, but even you as a provider can call the human trafficking hotline and express your concerns, and they will follow up on it. For those young people who are unhoused or thinking of running away, also there is the Runaway Safe Line, and they will support young people and also route them to support related to exploitation or abusive relationships. Fine. Next slide. I just want to thank you all. I know that's been a quick run through. I hope it's been useful or helpful to you. And we have a little time for questions, so I will let Ashley manage that.
Thank you so much, Erica. We so appreciate the presentation. That was a great overview, a lot of great resources and education provided throughout that. We did drop in the chat for everyone the one pager that has all the resources and the cards and the partnerships that Erica shared. So please check that out. And to kick off our Q&A, I see you've got one question in the chat already. Is there a train the trainer program for this sort of work?
Yes. So Futures does some train the trainers with, it has to be obviously in their work plan. So it's planned far in advance. But there's also we've been working with the primary care associations, and some primary care associations have elected to co-plan, organize, and provide a train the trainer through Futures. We have slide sets, etc. And there's that IPV and health. There's a online toolkit as well as downloadable as a PDF, and there are slides to do trainings on cues and general trainings around IPV. Now, there's not a specific youth-focused one. There are general healthcare ones. And I would encourage you to work with your PCA, who can then hopefully work with Futures. Again, a lot of these things you can access online or through the Futures website, but for tailored training, we do that. I do that. We come out to the state and do it. We travel around the state and do it. There's lots of different options. This work is funded by HRSA. This funding cycle ends in June 30th, and we are currently applying for a new grant. So we'll be doing this work regardless. We don't know if the role in terms of being the part of the national training and technical assistance program will be continued. That depends on funding choices by HRSA. But Futures does this work. They have resources to do this work. And then, of course, your Primary Care Association is also has funding from HRSA and may have some resources to do this as well. Long answer to a short question.
It's really helpful context though. Are there any other questions that we can have answered? We've got just a few more minutes left here. And while you're thinking on those questions, I'll ask you to please take just a moment for us. I dropped in the chat the evaluation. This is really helpful for us as we're reporting our different deliverables for our federal grant. The evaluation has just a couple of questions, starting off with information about today's webinar, and we're asking that you select other and just type in that it was the IPV webinar. And also, I just want to flag one of the last questions asked if you're working with a federally qualified health center or a rural health clinic. If you're representing a health center today, or you're representing a partnership with a school that works with a health center, please select FQHC. And if you're with either a state agency or just the school district, we're so happy to have you and ask that you select other and then reference that you're part of the school. Do we have any other questions come up for anyone?
I figure I've either done I've bored you so much that you're snoozing at the computer and can't even think to ask a question. But hopefully it's the former. Again, I know this was a really fast overview. These slides will be available to you, as well as, I believe, Ashley, a recorded version.
Yes.
I noticed on the projection, I think maybe because it was going through Google Slides, that some of the slides, they kind of the images overlaid. So if you download it in PowerPoint, or if you all save it as a PDF and send it out, hopefully the spacing will be better. If not, let me know and I'll try and send a cleaner version so that hotlines, etc., and links aren't covered up by graphics. Looks like I froze.
We can still hear you though, Erica. And we
Oh, good.
appreciate that. We'll make sure everyone gets a copy of the slides and the recording. And of course, you have our information at the PCA. Don't hesitate to reach out, and we're happy to help facilitate connections.